So what are the causes of the hip pain and how to predict the cause of the hip pain from the age of the patient? So you need to know that the preschool age is called toddler, which is below 4 years. Toddler in the first 3 years of life. This is the preschool age or the nursery age. However, the school age is called a child, which is between 4 and 9 years. This is the school age, between 4 and 9 years. The teenager age, the teenager or the adolescent is from 10 years old to 19 years old. That's why it's teen. Teen, it's 10, 11, 12, okay, until 19, okay. Then the older age is older than 20 years old, includes adult, middle age, older age. The adult age from 20 to 40, the middle age from 40 to 60, and the elderly more than 60 years old. So according to the age of the patient, you can expect the cause of the hip pain. Okay, so in the preschool age, the most common traumatic cause is non-accidental injury or child abuse. And the most common infective cause in the preschool age is septic, arthritis, and osteomyelitis. The most common inflammatory cause in the preschool age, the most common inflammatory cause of hip pain in the preschool age is juvenile idiopathic arthritis. There is no specific cause of disturbed blood flow in this age, in the preschool age. Okay. At school age or at the childhood or at the age from 4 to 9 years old. So at the school age, the most common traumatic cause of hip pain is non-accidental injury or child abuse. The most common infective cause of hip pain is septic arthritis and osteomyelitis. Okay. At school age, the most common inflammatory cause, two causes. One is specific for this age, for the school age, which is transient synovitis. Transient synovitis should be expected as an inflammatory cause of hip pain at the school age, together with the juvenile idiopathic arthritis. So the most common inflammatory cause in the school age, two causes, transient synovitis and the juvenile idiopathic arthritis. Okay. So how to memorize this? So at school age is a transient period. Okay, so the school period is a transient period. So transient synovitis should be expected in the school age, at the school age. And juvenile idiopathic arthritis, juvenile means any age below 19. Okay, so this is juvenile. Any age below 19 is juvenile. Okay, so at the school age, transient synovitis and juvenile idiopathic arthritis should be expected as inflammatory cause of hip pain. And at the school age, the most common cause of disturbed blood flow is Pearse's disease. Pearse's disease. So Persis disease is a specific cause of disturbed blood flow at this age, at the school age. Persis disease should be expected at the school age. Persis disease is idiopathic cause of avascular necrosis. So at the school age, you should expect the transient and the idiopathic cause of avascular necrosis as disturbed blood flow of hip pain. Okay. So at the age of adolescence or the teenagers, which is from 10 to 19 years old, the most common traumatic cause of hip pain is either a slip or avulsion. As you know, the teenagers always search for troubles. Okay, so you need to expect that slipped capital femoral epiphysis and avulsion fractures as traumatic causes of hip pain at this age group, the age of troubles. Okay, slipped capital femoral epiphysis and avulsion fractures are the common traumatic causes of hip pain at the teenager age. At the teenager age, the most common infective cause of hip pain is septic arthritis and osteomyelitis. So, septic arthritis and osteomyelitis, as you noticed, are common in all age groups. All age groups. That's why you need to exclude the septic arthritis and osteomyelitis first before any other cause, because these causes are common in all age groups. Okay, so at the teenager age, the most common inflammatory cause is juvenile. Okay, there is no specific other cause here. No specific other cause here. Juvenile idiopathic arthritis should be expected as inflammatory cause of hip pain in the teenagers. Okay, and there is no specific cause for disturbed blood flow at this age. Okay, older age, the most common traumatic cause at older age is traumatic or pathologic fracture neck of femur. The most common infective cause at older age is septic arthritis and osteomyelitis. The most common inflammatory cause at the older age is inflammatory arthritis. Inflammatory arthritis, all the types of inflammatory arthritis as rheumatoid, ankylosing spondylitis, psoriasis, gout, enteropathic arthritis. Okay. So the inflammatory arthritis could be transient and juvenile, could be juvenile idiopathic arthritis or inflammatory. Again, the inflammatory cause of hip pain could be juvenile idiopathic arthritis or rheumatoid arthritis and ankylosing psoriasis, gout, enteropathic. Other causes of inflammatory arthritis. The juvenile is expected below 19 years old, and after 19 years old, don't expect juvenile idiopathic arthritis. Expect the rheumatoid and other inflammatory causes of arthritis. Okay. At older age, the most common cause of disturbed blood flow that as a cause of hip pain is these causes: transient osteoporosis and avascular necrosis. Transient osteoporosis and avascular necrosis. So now how to So how to detect effusion in the hip joint on the X-ray. This is 42-year-old man with right hip pain and limp. The initial radiograph shows loss or narrowing of the right hip joint. Okay, narrowing or loss of the right hip joint. Here's the narrowing and here is the loss of the right hip joint with decreased bone density on both sides of the hip joint, seen in the decreased on the femoral side and on the acetabular side of the right hip joint, with displacement of the inferomedial fat plane, indicating that there is effusion. Can you see the soft tissue density displacing the fat plane? Displacing the inferomedial fat plane, indicating that you can see here also the soft tissue density displacing the fat, indicating that there is hip joint effusion displacing the fat plane. This is the same finding seen in elbow joint effusion, displacing the anterior fat pad superiorly and displacing the posterior fat pad posteriorly, so the normally unseen posterior fat pad is seen now with the effusion, and the normally seen anterior fat pad is displaced with sail sign. That means that there is elbow joint effusion. Here, the same basis, okay? So the effusion is displacing the fat, okay? This means that there is an infective fluid. Why? Because the effusion is not associated with widening of the hip joint. It is associated here with destruction of the hip joint, with loss of the joint space and loss of the bone density, decreased bone density on both sides of the joint. This means that this effusion is infected and causes destruction of the hip joint. This is a radiograph 2 months later. There is a rapidly progressive loss of the hip joint. Look here and look here. Can you see the narrowed hip joint here? The narrowed hip joint here? Completely lost now. So there is a rapidly progressive loss of the joint space as well as the bone density. Can you see the bone density here and the bone density here? There is progressive loss of bone density. This progressive loss of joint space and bone density is a characteristic feature of septic arthritis. That's why we recommend assessing a previous imaging of the joint once we suspect septic arthritis, because on previous imaging you may detect widening of the current narrowed hip joint, or you may detect progressive loss of bone density, which is a characteristic finding in septic arthritis. Okay, so there is loss of visualization of the cortex as well as subcortical erosions and cysts. Okay. So the interpretation, the findings would be suggestive of a unilateral infective process in the right hip joint with a rapidly progressive loss of joint space as well as the bone density, along with the history of infective endocarditis. Septic arthritis should be considered. However, inflammatory arthritis should be considered as there is evidence of joint space narrowing. The management here is clinical, further imaging, diagnose, treat. Clinical, I would correlate these radiological findings with the patient's history of fever, either fever or infective endocarditis, or okay, so why infective endocarditis? Why we need to look for a history of infective endocarditis? Because infective endocarditis causes septicemia, which is a risk factor for septic arthritis. Why we look for sickle cell disease in the history of the patient? Because sickle cell disease increase the susceptibility for capsulated organisms infection as salmonella. Okay, so I would recommend further imaging. I would recommend an MRI of the hip to assess the degree of joint destruction and the involvement of the surrounding soft tissue, because I can see the involvement of the soft tissue, of the adjacent soft tissue on X-ray. Then I would recommend what to diagnose. Okay, I would recommend image-guided aspiration as there is evidence of joint effusion. Okay, I would recommend the image-guided aspiration of the hip joint fluid, which is the gold standard to diagnose. Why? Because aspiration of the hip joint fluid will allow culture and sensitivity, and this will allow culture-guided high-dose intravenous antibiotic therapy. How to treat orthopedic referral to guide the treatment plan, which may include the antibiotic therapy as definitive treatment as well as symptomatic treatment by image-guided drain placement or surgical drainage of the abscess. So that's it. Thank you.